listening.
And welcome. This is the Locked and Loaded Show.
Good morning, everybody. Welcome to the Safe Senior Hour with Joe Gavalis. And remember, we start off every program with that elder abuse does not report itself. Thank you for listening. And today we're very honored to have a guest, Kathy Floyd, who is the Executive Director of, we call it COAGE, Kathy, but what is the official name here?
So the entity is the Georgia Council on Aging, and we administer a coalition of aging advocates called COAGE.
And Kathy, you want to just give us your background? And so you've been a long time advocate of supporting the rights and helping seniors.
Yes, Joe, I have. I've been active advocating for seniors in various positions for just about 25 years now in Georgia. I have a background in politics. I want to share with you that I handed out campaign buttons on the school bus in the parade in 1964. So I've been interested in politics for quite a while.
But didn't you have a spell with the AARP?
Sure. I have an MBA in finance. I spent my first career in financial advising, and then I had a transition and worked for AARP for 19 years, and now I've been with the council for 5.5 years.
True advocate,
yes.
Which we appreciate. I'm just going to go over here and just have you just go over your mission.
Certainly.
For this. Now, this is kind of a unique entity within kind of quasi-state government, right?
It is. We were created by the legislature in 1977, and our purpose is to advise the governor, the General Assembly, and state agencies on the wide range of issues that impact the 60-plus population in Georgia. And I report to a council, which is sort of like my board of directors, and there are 20 folks appointed by the governor, lieutenant governor, the speaker of the House, and the commissioner of Department of Human Services. And those folks really set the mission and the tone, and they're volunteers, and they serve from all over Georgia in a volunteer capacity, and they are all passionate about improving the quality of life of Georgians. So we are dotted line attached to the Department of Human Services, but those volunteers that are appointed really set the tone and the mission. And we have, I have 2 staff that work with me, so there are only 3 of us, but we really take our mission very seriously and work hard to improve. And elder abuse is a key part of what we work on.
Right, and I see some of your objectives there. We interact from the North Georgia Elder Abuse Task Force as we bring and highlight issues that need legislative support.
Right.
And that laws changed, laws tweaked, laws improved, and you all are. I know you're on the state committee with us, and the idea is to bring this to the attention of the legislators and let them, since they make the laws.
Correct.
And hopefully the governor will sign these bills. But but it is basically geared to help protect our senior citizens. Now, you go a little farther. Now, you look at the whole elderly issue.
Correct. So we work on issues like helping people age in place. So the home and community-based services, all of the ways that people can stay independent in their homes as long as possible. And this is not only the right thing to do, it's not only what people want, it also saves taxpayer dollars because nursing homes are expensive, and over 80% of the beds in nursing homes are paid for with taxpayer dollars.
Wow.
So anytime you can keep a person at home, we've found that it's 1/10 of the cost of what it takes to take care of them in a nursing home. Now, sometimes people need to go to a nursing home, but they don't need to unless they need that level of service.
Well, there was a program, I think we had Lynn Reeves on from the regional commission, and up in Rome, Georgia. But there's a program, I think it's funded by federal or state dollars,
Right.
to try to get people to help them get out of nursing. Are you familiar with that program?
Right. So we do as much as we can to keep them out on the front end, but people do go in. They don't know what all their options are. And so there are two programs actually in Georgia.
Okay.
Money Follows the Person is a federal program, so it's a federal state match, and it moves people out of nursing homes. The Council on Aging was instrumental in getting the state program started, which also moves people out of the nursing home. But the state program was started because there are some restrictions with the federal program, like you can't move them into anything but a 4-bed or less home. And Georgia has a lot of 6-bed homes. And so we had people that could come out, people that could go to a 6-bed home, but they didn't have that transitional funding. So now there is another program, the Nursing Home Transitions Program,
Right.
which will help them get out and get back home, and it doesn't have as many of the restrictions that the federal program. So it fills the gap with the federal program.
Well, I think it's a great program. I think you see maybe less issues on the whole.
Right.
When you're at home, people are happier.
Right.
And then if you get sufficient and safe home health care, that helps
Exactly.
them. And the senior seems to like that. I thought it was interesting. You said you look at it from age 60, where a lot of senior laws are written at age 65.
Or 62.
Or 62. And I think some federal laws or rules are 55.
Right. It's the Older Americans Act that starts at 60, and so that's generally what we
you
look
do.
at. Now, we have that Nursing Home Transitions Program actually goes down to 55.
Oh.
Because, and what we did is we looked at it in a practical fashion. The people that are not getting help, where are their ages? And we saw that we had some 58, 59, 56 years old. So the legislature said, okay, let's put it back to 55 and above. So we really look at it in a practical viewpoint as far as the people that are impacted.
Well, let me ask you, and when you deal with government, hadn't been in government for 30 years myself, there are a lot of things called by different names, but do you have any, since this goes all over the United States and even all over the world, this show, what should people look for in their states or the type of organizations that would be similar to yours, where you have the citizens helping to look at drafting legislation or bringing the problems? Are you aware of other similar situations?
We are somewhat unique. There are organizations that are part of state government in other states, but generally they are a part of the Division of Aging and the services side. And we are somewhat unique in our independence, which we really appreciate. We have talked to some other states. In fact, I've been doing some phone calls with a former AARP advocate in North Carolina that's looking to build up a 501c3 to do some of the things that we're doing.
Wow.
So, and I know that there are some in other states. I'm just not aware of.
I think Tennessee has a similar through the legislature, and
Right.
and I was just looking at a list that we had here, and I think I gave you a copy. It goes state by state of what's available, and as Kathy just was saying, most of them are through the
Division of Aging.
You're right, but as you go through, I'm just looking through here. Idaho, for example, has a commission on aging.
Right.
There's
And you may have a silver-haired legislature. Many states have a silver-haired legislature, and Georgia used to have one.
I'm not sure what that is. What does that
Well,
mean?
it is, there's a little bit of state funds, and then you have volunteers that serve. There's sort of like a shadow legislature.
Really?
And so that's an interesting idea. Georgia had one, but it was defunded a number of years ago. But that is a great model where a lot of retired folks will serve as somewhat shadow senators, shadow representatives, and then they develop their own.
Shadowing, you mean trying to bring the interest of the elderly to the legislature.
Right. So they serve as just like our champion Representative Sharon Cooper would serve
Right.
from Marietta, they would have a representative for her district that would be the senior head legislator for her district.
Interesting.
It's a great model. Unfortunately, like everything, it costs money, and that's that can often be the rub. But I've seen that work in other states too.
Well, I was just looking through here in Louisiana. It's the Governor's Office of Elderly Affairs,
Yep.
which I thought was interesting.
They have that in Florida.
Okay, and then Minnesota, it's the Board on Aging. So again, when I'm bringing this out for the listeners, it might not be a council or anything. It might
Correct.
be under another name, but you always can talk to your Division of Aging or something like that. Right. In Florida, it's the Department of Elder Affairs.
Right.
Mississippi is a Council on Aging, which I thought was very interesting.
Interesting.
And that, maybe that we can get an idea of what they're doing. We can get a call. In New Hampshire, the Bureau of Elderly and Adult Services. So again, we're saying this so you can be aware, as our listeners around the country, doesn't start with the way council or whatever it is, Oregon.
Right.
Seniors and people with disability. These are all state issues here. I'm just looking at South Carolina, Lieutenant Governor's Office on Aging.
Yep.
But it's important, and here it is, Tennessee, Commission on Aging and Disability.
Oftentimes, you have overlapping initiatives with at-risk adults, would be both elderly and also
Right.
folks living with a disability, and there are a lot of opportunities to work together.
Right, I'm just looking here again, and we're just going to end up here as I go through here. That's the Wyoming Aging Division, Utah Division of Aging and Adult Services. So please, if you have issues, just look and go, look in your state, just start making some calls if you want to get involved. The people who are involved can help change laws and we say tweak them. And tweak them is very important, because as you look at these statutes, a lot of them have a lot of issues that just need a little tweaking to be more readily acceptable by the community.
Yeah.
And that's what you all do. I mean, I know we're on that. We're going to be taking a break here in a few minutes, but we'll discuss about how here dealing with elder issues are brought to the attention of our legislators and our executive staff. Now, I'm not sure that there's that much interaction directly with the state agencies, and I think that's it. I mean, you talk to them, I know we talk to them, but they're pretty much they have their own budget and things like that, so we have to go through the legislature to affect that. Is that pretty much a fair statement?
That's true, and in each agency, each department has its own initiatives. Now, we can give you an example of the fingerprinting. I mean, we talked about the need for caregiver registry, and look at who is currently had elder abuse in their background.
Right.
And that evolved into the Department of Community Health taking that initiative and running it with themselves. So sometimes you can make it work that way, but I have good communication with their individual governmental affairs staff. We try not to be at loggerheads ever.
Right. Well, I think it's it is an issue, because sometimes what the government wants to do is not necessarily what from the out in the community wants to do. Well, with that, we'll end our first segment of the Safe Senior Hour, and we'll be back for segment 2.
The Docs for Patient Care Foundation is worldwide and join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
This is Ron Camacho, host of the Business Hour, on Fridays from 10 to 11 a.m. Join me as I talk with passionate professionals on a program that profiles the best businesses, business practices, and fascinating business professionals to get an insider view of how America works. The Business Hour from 10 to 11 a.m. on America's Web Radio.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the trained staff at the Atlanta Healing Center address and treat every day. Their doctors and counselors with over 40 years of practice in the field of addiction can treat the suffering individual in a thoughtful, compassionate, and experienced manner and guide him or her along the path to recovery. So call 770-696-9862 and speak to a knowledgeable staff member about how you or your loved one can be helped to enjoy a better and healthier life. More information is also available on the website at www.atlantahealingcenter.com.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Well, welcome back to segment 2 of the Safe Senior Hour with Joe Gavalis. We're honored today. We have our guest, the executive director of the Georgia Co-Age, Kathy Floyd, who is a true advocate to, and you have been through your whole life, helping seniors and helping address the wrongs that have been going on. We thank you for being here, Kathy. We just had a good segment in the first part, going into a little bit about what the different states can do and how they're called by different names, but it's still the whole idea of having people trying to help people.
Right.
I think that's significant. What we wanted to do on this point, you were talking about how you addressed an issue that Georgia, I think it's kind of unique, or let me step back, that one of the big issues is trying to figure out in the elder abuse area is for the citizens when they go out to try to hire people to take care of their loved ones, that there is a registry that you can go to. The gold standard by far is Tennessee, and my hat's off to Tennessee. And they've been doing it for like 20, 25 years.
Right.
Very good. And that is done by basically court cases and people reporting and investigation. But Georgia is trying to start, I would say, a pilot program. I don't know where else it's being done. Do you want to go into that? Because you all were supportive of that program.
Well, Georgia is launching their registry as their requirement for fingerprinting launches. And the idea is that anybody that works in a licensed facility, so that is a nursing home, that is assisted living, that's personal care home, that is hospice, home care, then those workers would be fingerprinted. And that way you can tell if they've had prior convictions or not. And as that information is gathered, and it will not tell what the convictions are, it just says yes or no. It will be put in a registry so that when an individual is looking to hire, maybe somebody, terms out of working for assisted living and they go to a home care company, or they're, they find them through various sources, they can check this registry with no cost and see whether they've been fingerprinted and cleared or not. Now, of course, it's not, you're not going to find everybody, but it's just one more resource, and it is only adjudications. So it does not include substantiated cases like Tennessee. But I think it is, the first step in a good direction.
Well, it is, and the idea of fingerprinting is not unusual, that people are fingerprinted for daycare services.
Right.
Stockbrokers are fingerprinted. I think bankers are
State employees are fingerprinted.
So it is a step forward. And I think what Kathy just said, it's not perfect, is absolutely true. It's only as good as people put the input in.
Right.
And, and it deals with arrests and hopefully then the adjudication or convictions reported, but not necessarily. So there are people that will look at it if something comes up, but it is a way to help to keep people who have been abusing anybody. It doesn't matter whether it's elderly, child abuse, regular abuse. Abuse of anybody is wrong, and you don't want them with your loved ones or with people you're looking to take care of.
Right.
We had a horrible situation in Georgia where a woman, I think we talked about it last week, but she was in an assisted living, I think, and the woman had dementia, and she ended up, the caregiver ended up burning her with cigarettes. Horrible situation. But the significance, that woman had several priors and convictions, not just arrests, and the system should have hit that.
Right.
The system today should have hit that. So there are always things are going to fall through the cracks, but we can't let that not try to move forward and get a system to help everybody.
Exactly.
And again, what Kathy said, the important thing is, if you want to try to hire somebody to take care of your mom, or your grandma, or your aunt,
Right.
where they're not going to be in a home or whatever it is, an individual. I know in Tennessee you can look on there and say, and they will say what the issue is, whether it be abuse, financial abuse, whatever. So you have an idea of what their conviction or why they're on the list.
Right.
And let me say, the list, everybody out there concerned, oh, we get on a list, how do you get off it? Every person on the list in Tennessee, and I think even Georgia, there'll be an appeals process.
Correct.
Right?
There will be. In the Georgia registry, there will be an appeal process, definitely. One thing I do want to add, you may have a home care aide that is a certified nursing assistant.
Right.
Only, I don't know if it's something like 30%, 20% of the folks that you look to hire will be. But if they do tell you they're a CNA, a certified nursing assistant, there is a registry in Georgia to check, and that is in the Department of Community Health website. So you can look up if they are a certified nursing assistant and see if they have any history. And those even include substantiated cases. So that is a good a resource for that.
That's just not Georgia. That's under the federal law, and that's
In
what
every state.
they help to fund that. But I will tell you, having worked in the big bureaucracy of the federal government, a lot of times it isn't that easy to get through and try to find out. But if you're persistent, somebody will help you get to the right party, the right area. Tennessee makes it very easy, and again, my hat's off to Tennessee. But I think Kentucky has a good registry. Delaware has a good registry. Mississippi.
Ohio.
Oh, really? Okay.
Mm-hmm.
Wow. So I think that's that hopefully that'll help, because that's all we're trying to do is not put any of these very vulnerable
Right.
Loved ones in the hands of somebody that you wouldn't want to be around or be with. It's just sad. But anyway, that's the kind of actions that I know Kathy's group takes, supports, and all that is for the betterment of the seniors. It's not anybody's picked out anybody else. It's just all for how can we help the seniors.
Right.
Your interactions with the legislators, how have you found their attitudes towards fighting or helping seniors and fighting abuse here?
Most of them are very willing to help with the fight for elder abuse. The vast majority, no matter if they're a Democrat, Republican, if they're a senator or representative, they are very willing. And it's because a lot of legislators do their job because out of their passion for making change, making things better. But even if you run into a politician who's, out for themselves, and yes, some of those do exist, they know that seniors vote. And that is a great incentive for a legislature to help out the senior population, because they know that if they can get the word out that they've helped seniors, then that's gonna influence voters, and that's something that definitely holds true.
Well, I think that is absolutely right, and I think you remember, to our listeners, when we here on the Safe Senior Hour talk elder abuse, we're talking three types: physical, financial, and institutional. Because when people use the word abuse, they just think of the physical abuse.
Right.
But there's more to it. The biggest abuse, in fact, a study just came out the other day about older adults are scammed more often by relatives and strangers, and financial abuse is by far the biggest abuse affecting our senior population
Across the country, for sure.
Right, and it's growing, and our population's growing.
Right.
I thought there was some statistic, and maybe you have a better idea of a better example, but I think it was the state of Minnesota that in the year 2025 will have more people over in a senior status than they will under like 30 or something.
Right.
It was an incredible statistic that shows you how the population is growing and living longer.
Right. And I mean, you can have that too. We can see North Georgia, when you have any area in your state that's, attracting retirees, then, that area is going to, trend older. And we definitely have that in Georgia, in North Georgia. So it's happening everywhere.
Let me ask you, and we were talking about in the break that your representatives come from all over the state here.
Right.
How do they interact with their regional people, with their citizens? I mean, do they go out? Do they hold meetings? What do they do?
My council members do a wide variety of things. I have 10 consumers and 10 providers. So my providers, for instance, one of my council members is an ombudsman. And so she's working every day. She's an ombudsman in rural Georgia. I think she has something like 12 counties that she covers.
Wow.
And so she's on the road a lot. And she also does provide programs about what the council does. I have a retired member who is my chair, who, Joe, Vicki Johnson, is active, working 4 or 5 days a week on council work in her, in her retirement. The chair of the Georgia Healthcare Association, the Nursing Home Association for Georgia, is on my council. I have a council member who has just opened a brand new assisted living facility in Swanee, Georgia.
Wow.
Beautiful facility. It has the independent units. It has the assisted living. It has the memory care unit. I really have a wide range of council members.
For our listeners, you got to remember these council members are volunteers.
They're volunteers.
Right. They're not getting paid. This is not a great, a job you're going to get rich at.
No.
It's because they're mostly all passionate and very concerning about dealing with elder issues.
Right.
Now, how do you get these people together? How do you have your meetings? What do you do?
Well, we currently are having 4 quarterly meetings,
right.
And we, get together for one day and do all of our planning and setting policy, looking at the budget, all of the different aspects, just like a board meeting for a board of directors, setting policy. And they talk to their individual legislators. They have connections with the leadership in the state, and they are working on senior issues. And some of them are more active than others, but it's a great group.
Well, I think that is important, and the idea that they do meet and they do interact out in their communities. But we're going to take a break or end our second segment of the Safe Senior Hour. When we come back, we'll talk about what some of these meetings are like when the public can come to them. So with that, we'll move on and end our second segment.
Hello, I'm Dr. Mike Karuchak. Have you ever wondered what doctors talk about amongst themselves? If you do, join us on the Doctor's Lounge and hear the doctors' conversations amongst themselves. Join me and my co-host, Dr. Hal Schertz, every Thursday morning, 8 to 9 a.m.
45 years of experience is behind the most trusted name in auto transportation. Passport Transport, the first and finest today. That's why Passport Transport is the preferred auto transport for major auto manufacturers, concours, museums, tours, and collectors, and should be your choice from across the state to across the country. When you have the need, go to PassportTransport.com and enjoy the peace of mind referenced experience will give you. Passport Transport.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the trained staff at the Atlanta Healing Center address and treat every day. Their doctors and counselors with over 40 years of practice in the field of addiction can treat the suffering individual in a thoughtful, compassionate, and experienced manner and guide him or her along the path to recovery. So call 770-696-9862 and speak to a knowledgeable staff member about how you or your loved one can be helped to enjoy a better and healthier life. More information is also available on the website at www.atlantahealingcenter.com.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Well, welcome back to our third segment of the Safe Senior Hour. Again, remember, elder abuse does not report itself. And if you have any comments or thoughts that you would like to bring out to the station, you can get us at safe@americaswebradio.com. So with that, we'll go back to our guest, Kathy Floyd, the Executive Director of COH here in Atlanta. And we've been discussing how this volunteer organization, or 99% volunteer organization, works in order to bring people from all over our state. For the people who are not familiar with Georgia, Georgia is the biggest state east of the Mississippi, so it covers a vast geographic area. And as we know, and our listeners know from our discussions, the targeting of potential victims by these professional scammers has been rural areas, just because they feel law enforcement and the people aren't getting the message out. And if you remember what we said last week, was that there were over 1 million attempts to perpetrate the one ring scam, where it was your phone rings one time and then it leaves a number. And people who are very susceptible to say, well, who was it? They call back and they dial the number, and the number a lot of times is the area code is only three numbers, so you don't think it's a foreign one. It's like the Caribbean or somewhere. But the cost is amazing, and it's billed on your cell bill or your phone bill. And these people, if they do 1 million attempts, all they have to do is hit, one out of every 1,000, I guess, and they'll get rich. But anyway, so we made that, it just, we need to make people aware of this so they don't fall into these scams. We'll go back to Kathy now on talking about the council. We talked about councils, the local representatives interact locally in their different regions. Right. They're all volunteers, and they bring this knowledge back to you and right. when the council meets. But you do some other things to communicate and interact with the public. What are those?
Right. We are very proud. We are the ones that convene Senior Week at the Capitol, where we bring seniors from all over the state to the Capitol to talk to their legislators about the issues that are important to them. The council has been doing this for 30 plus years.
Wow.
It's
that's great.
We've actually had to cut off the attendance because the building authorities told us we can only do 300 a day, and so we do that. We do that every February, and it's very popular. The seniors really enjoy it, and it connects them with their legislators. And that is one of the ways that we are able to impact legislation and build that relationship with legislators. And we also hold public meetings. In April, we have what we call Engage with COH, which this year we had 32 sessions around the state, over 1,000 attendees.
Wow.
And we have our members partner with us and put on these sessions. And these sessions are a little less than an hour, and we update the seniors on what happened at the legislature, and then look for issues for going forward. In July, we have a big public meeting in the middle of the state in Macon. Generally have about 140 seniors show up, and senior advocates. And then in October, we have our education meeting where we talk about the issues and give seniors the materials that they need to talk to their legislators. Your members of Congress get a lot of attention, and they get input from consumers, but
Right.
your state legislators don't generally get a lot. And so you can make a difference if they get 5 emails or phone calls on an issue. That will perk up their ears, and they'll figure out, okay, what's going on with this? And so your numbers to make a difference are much smaller at the state level. And I would urge you to get to know, your state or local elected official, because they are anxious to hear what people are thinking about and talking about.
We were discussing it earlier that it is amazing that our legislators are there to make laws, change laws, remove laws, and when you talk to them, and of course we focus in on the task force on elder abuse issues, when we have them come to a meeting and listen to what is going on in their community, in their district, not what's necessarily happening all over the world, and as we go out and we tell people, when we discuss these, for example, in the financial world, these professional scams, these aren't scams that are going on in New York or Chicago or the big cities or in downtown Atlanta. These are happening all over and in these districts, and they've come out of the meetings just totally, number one, amazed at the hardships that seniors are going through, and realizing that they can have an input to help. And it's you with the council, and I know in that state working group, where we can bring up issues to them of what needs to be done. And I think, as you just explained, Kathy, talk to your representatives, right? State whether it's a state rep or a state senator.
Right. I mean,
they want to hear it.
They definitely want to hear it, because if you make the effort to talk to them, they know that there are numerous other folks that thought about it, just didn't put the effort into contacting them. And so if you give them a local issue that they can champion, then that's something they can talk about the next election. And it's just a circular equation that you really can have an impact.
Well, and again, just take politics out of it. Everybody, I would venture, 98%, either they've had a issue with some kind of abuse, remember, physical, financial, or institutional, with one of their loved ones, or they know somebody that has. It's not like you're talking about something that never happens. So when you bring an issue up, they will listen. And you remember, our representatives and state senators, in every state, almost every state, this is not their full-time job.
Right.
They live in the community.
Right. Exactly.
And they'll see it. So if you see them, they'll be glad to talk to you. I've never had somebody slush you off. Is that the word? Or flush you, whatever the term is, flush you off, where they say, no, I can't talk to you, unless they're going to a meeting. But they'll say, call me later.
Right. I'll share with you, Joe, the first big elder abuse bill that Georgia, with this, because we've had a number of years now where we've been really leading the country with good elder abuse legislation. I believe it was 2012, and that was House Bill 78, Representative Wendell Willard, right? represented this area right where we're sitting. And in the House, when it came up for a vote, there was only one vote against it. And that's the thing about elder abuse. Nobody wants to be on the wrong side on
Right.
elder abuse. You work out a lot of the details, the legal stuff in committee, and then when it came to the House. Now, let me tell you about that fella that voted against it. A very good attorney, elder law attorney, used that against him the next election and beat him.
Really?
So he suffered for having that no vote. And the elder law that replaced him is now an excellent legislator.
Well, it's as again, as I said, everybody's aware of it. It affects them, but I don't think anybody really is aware of the extent that
Right.
it takes place out
Right.
there. And remember, elderly people. We talk about why are we addressing it? Why are the scammers? Why are the relatives doing it? Because people have been very trusting.
Right.
Growing up, our generation.
Right.
Number one. Number two, and they've saved a little bit of money.
Right.
A little bit of money could mean $500 or $200 to some people, but it could be hundreds of thousands of dollars in a retirement plan.
It may just be, using their Social Security check instead of them
Absolutely.
getting it. So, just their Social Security benefit can attract somebody to scam them out of it.
And it's fact that Georgia just one of the first states that we've made under the exploitation law. They've changed it where trafficking in humans for their money. Now that's for their benefits, basically, is it?
Right.
Because we've had people go and see, the unfortunate people that might be down and out that just get a measly Social Security check or a veterans benefits check or food stamps, that they'll pick these people up, sign them in, get control of that little bit of money, or get the, for example, the food stamps issued, and then they just take them and then misuse them, and then give these people alleged place to stay, and alleged some of these conditions are horrible. Some of them
Right.
are good, but some of them are horrible. So this trafficking for benefits, Georgia put a law in.
Right. And I know that it has already been used in 2 cases so far. And, what's involved here is you've got a prosecutor that's looking to charge a number of different charges, because what you're trying to do is, stop this person from doing it again. And so this is another charge that's been added, and they've already prosecuted 2 cases with this. And it's just shameful when they raid some of these places and they've got this stack of cards, and that's, so their Social Security card, their EBT card, that's the value for them, and they stuff them in substandard conditions and feed them or not feed them, and it's just shameful.
I know in one of the cases here that EBT cards are what you used to call food stamps.
Right.
And now they're cards, and they get access to them. And I remember one of the investigations, they followed them. That card was sold for a percentage on the dollar and was
Right.
being used in South Carolina.
Right.
And when it was issued to a gentleman in Georgia who was living in a unlicensed personal care home. So you can see it's a domino effect, and we can be very thankful here in Georgia. The law has kind of kept up with this,
Right.
because they'll listen to groups, they'll listen to people who do this, and who do this for a living, that fight elder abuse,
Right.
and say you need to make the changes. So I think we're lucky here in Georgia that we have that, and we can see changes being taking place all around the United States. Well, with that, we're going to end our 3rd segment of the Safe Senior Hour, and we'll be back shortly.
The disease of addiction is a life-altering challenge, not just for the person suffering its effects, but also for the family and friends who support and love the one caught in its grasp. What should be the course of treatment? Who is the best person to render treatment? And what is the best place to go for the care that is needed? We know that you want answers to these and many more questions. Call 770-696-9862 and speak to a representative of the Atlanta Healing Center. They can tailor a program specifically designed to address the needs of the person suffering with an addiction, or give you guidance as to where that help may be found. Information is the key, and the trained staff at AHC is here to assist. If you wish, you can also get more information on the website located at www.atlantahealingcenter.com.
This is Ron Camacho, host of the Business Hour, on Fridays from 10 to 11 a.m. Join me as I talk with passionate professionals on a program that profiles the best businesses, business professionals, business practices, and fascinating individuals to get an insider view of how America works. 10 to 11 a.m. on America's Web Radio.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Well, welcome back to the final segment of the Safe Senior Hour with Joe Gavalis. And we are very fortunate today to have Kathy Floyd, the Executive Director of the Georgia COAGE, with us. And Kathy, we appreciate you coming today. And,
Joe, thank you.
And giving us your insight and trying to help educate people on your passion, that's helping seniors.
Definitely.
And your lifelong career has shown that. Let me just ask, I think we talked about before, and there's another service you do, and people can go on the internet and get their newsletter.
Right. We have several communication forms that we use. We do a monthly newsletter and then a weekly newsletter during the legislative session. And it's on our website, gcoa.org, GeorgiaCouncilOnAging.org. You can sign up for free for the newsletter. We have a lot of information on that website, resources, and then we also are very active on our Facebook page, Georgia COA. The Facebook page gets a lot of traffic. We are posting daily on our Facebook page, and any kind of scam, we hear about it. We get that information on our Facebook page and share all different kinds of information. So check out that Facebook page too.
I hope that you add America's Web Radio and
definitely.
And the Safe Senior Hour. It's every Monday, 10 to 11, and we certainly are looking to try to have people at all times listen to us and help us. So we'd certainly appreciate that. And again, we do this as a volunteer. We're not paid.
Appreciate that.
And so we just need to have to get education out. And we've spoken, and I tell people this, federal agents spoke, talked about all these crimes that took place in one of the Caribbean countries, said, well, what can we do? It was all law enforcement. And what can we do to help? And we said, give us 3 things. He said, education, education, education. So this idea, what you do, what we try to do on the radio, what we try to do throughout in North Georgia, speaking on local radio stations,
right.
Going in and having small groups, either at senior centers or some kind of faith-based groups.
Right.
We're speaking next week to 2 veterans groups,
right.
which will be an honor to the people who had served. So what you do is great. And did you give your email or your website that people can
right.
go on,
sure,
please,
sure.
if you could do that?
Sure, it's www.gcoa, so that's GCOA for Georgia Council on Aging.org. And like I said, we've got lots of resources there, and we've got our contact information, plus emails and phone numbers for you to ask for more information.
And I think you can sign up for the newsletter,
right? And
right?
you can sign up for the newsletter. Our coalition, for those of you in Georgia, You can join for a free membership. You get to do everything but vote on the issues, and the individual membership is $25 if you do want all of the benefits plus to be able to vote. Every July, we vote on what our issues are for next year. We have a totally democratic process that we choose, and that's how people set our priorities for next year. We got a couple of new ones, Joe, for next year, looking at helping in senior living with behavioral health problems. We've seen a pilot in the Atlanta area that has reduced the eviction with having a resource officer that can help with behavioral issues. It may be hoarding, it may be, there may be some dementia going on, and so having a resource person that can address those issues has really reduced eviction rates. And of course, when you reduce eviction rates, you're going to reduce the number going to a nursing home and or homelessness.
Eviction from what?
From senior housing.
Oh, okay.
From senior
right.
housing.
Okay.
So that is our new, and then our other one is very, very important: transportation, supporting ways to increase transportation options for seniors.
Well, all those are very admirable, and hopefully you can get them through in a legislative manner. One of the important things that we have discussed, certainly in some of these groups that Kathy and I are both a party to, is a mandated reporters. That it's very significant. The law in Georgia is very, very broad and very good, but it always can be tweaked a little.
Right.
And again, check your states and see what are the requirements.
Right.
In Georgia, it's a huge list of people, but basically, if you take care of a senior and they're dependent on you, you're a caregiver.
Right.
If you do it in your professional capacity, you're a caregiver. In Georgia, financial institutions are mandated reporters
for financial exploitation.
Right.
For that part of it,
which
and you
is
can
important.
imagine they're the ones that see it. They're the ones that see the elderly person being driven by a caregiver to the bank to pull money out. They're the ones that see it, and that move has really helped in Georgia because it not only puts the onus on them to report, it also gives them immunity, so that they cannot be sued for doing that. And that, for banking officials, was really, really important. They want to tell what they're seeing, but they don't want to be, sued by somebody. So that's been really helpful.
Well, that has been very helpful. And again, in Georgia, which is very unique, the mandated reporters must report both to the regulatory civil component, Adult Protective Services, and local law enforcement.
Right.
It's not or, it's and. And that we have now, through these task force meetings, we have about 5 or 6 of them through North Georgia, that we get together and people interact because basically crimes have no boundaries. It's not like where we live, you live in a city, but you live in a county and obviously a state. These people who commit these crimes mean nothing. I know we're working a matter up in Northwest Georgia. The perpetrator lives, alleged perpetrator lives in Alabama, but crosses over into Georgia. We have issues where for along state lines, and you can see it in your states or your country. You can see this when a situation of maybe a very abusive situation, and I'm thinking here in North Georgia, because I can address that very easily, where somebody is found in such an abusive situation, whether it's self-abuse or whatever, the idea of laying in your bed with these horrible bed sores and not being just horrible situations, they are taken out of state to because the nearest hospital is just over the line, and this is in like Chattanooga. But this happens all over the United States, that you'll be taken either from Alabama to like Columbus to the hospitals if you're close. So we do need to partner up with our brothers and sisters in the different states, but also when we get to the county level or the local level, we need to interact, because just because somebody lives in one county, they could be perpetrating crimes in the other.
Right.
When I say crimes, these are just, for example, horrible living conditions or abusive situations with seniors. And again, remember, elder abuse does not report itself. So if you think of anything, or you hear of somebody, that has that just is going to confide with you that, my grandchild is here and there's something wrong. When he comes here, he always wants to use my credit card. I just heard this the other day. He always wants to use my credit card. What do I do? Or the extent where some senior tells you, I had to agree to go into a home, or else, I had to agree to give my son or grandson a check, or they're going to put me in a nursing home. Right? You've heard that.
Right. Yep.
And these idle threats, and to a senior, it's not idle. They don't want to do it. They don't want to leave their home, and they don't want to live someplace else. So we're very fortunate. We have good mandated reporting laws. And one of the big issues that we have here which is really significant in the criminal world, and I don't want to get too far in the weeds, but we have made in the state of Georgia exploitation of the seniors a RICO predicate act. And all that means is it makes it easier to prosecute, easier to seize funds when elders have been abused or been exploited. And they do use that all the time. People are sentenced on that, and they're based on that and has a higher threshold. And we have taken the lead, and I think we were talking about it the other day, and Kathy's group has been a main part of it. We have enhanced penalties now for crimes against seniors. Are you familiar with that in detail? Right.
Right. Yep. It's something that Georgia is constantly looking to. We involved with law enforcement, prosecutors. What are you running into? What problems are you having prosecuting a case? And then we come back and say, okay, that law needs to be tweaked. So Georgia passed a really strong battery provision, and then they found out through a few cases that the lesser battery was still on the statutes.
Right.
And so the judge, in choosing, would choose the lesser one. So even though it was on the books that you could be charged as a felony with battery of a senior, because battery of a senior was still a misdemeanor in another part of the code, that's what they went to. So we had to go back to the legislature, take that out. And so these kinds of things, don't happen one piece of legislation one year. You do look to improve and, like Joe said, tweak them.
Well, this is the importance of the council, and I hope in every state and every area you have something like this. If you don't, try to start it. It has been a great plus here in the state of Georgia. The voice of the citizens can be heard, and the voice to help the elderly is certainly a voice that needs to be heard, as we're all aging, and unfortunately more of these abuses we have seen kind of taking place. So it is again very, very significant of what your group does. And again, it's volunteers that are out there.
Right, exactly.
And I can't stress that enough. So people say it's not the government that's out there paid with your taxpayers' money. It's people who independently want to do this. And so, with that, we're going to be ending this segment very shortly. Kathy, thank you for coming.
Thank you, Joe, for all you do.
And we hope that you'll come back here as things move on. And we look forward to working with you and your organization.
Great.
So with that, this ends this segment and today's show on the Safe Senior Hour. Remember, elder abuse doesn't report itself. We'll see you next week.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
This is Ron